guys, Corona Bry here. Just finishing up my day. It's about 3:52 a.m. Friday, March 27, 2020. I'm getting ready to go to sleep. Probably did about 16 hours, and I'm just gonna engage in some research and education. And this is regarding actually what is killing people with this coronavirus, which is ARDS, Acute Respiratory Distress Syndrome. Really have to understand the mechanisms here if we want to make a difference and do something about this. Kind of know what's going on. So I'm given full access to my personal research library, and hopefully if you guys give you an idea where my head is, my headspace is, and the type of independent research I've been doing, and I've been doing for many years now, and I have a huge library. This is pretty advanced, so a lot of people want to understand it, but anyhow, go ahead and get started, and then get some sleep, and see if I can get out tomorrow to make some more money. I'm way behind on the bills. I am sleeping in my car. I do have a donation link set up. Just trying to get bills paid and get to college and get through this coronavirus shutdown situation.
Acute Respiratory Distress Syndrome, ARDS, diffuse alveolar damage, DAD, shock lung or hyaline membrane disease. Definition: acute respiratory distress syndrome is an acute, diffuse inflammatory form of lung injury that is associated with a variety of etiologies. Respiratory failure occurring within a week of a known clinical insult with bilateral opacities on chest imaging, not fully explained by effusions, atelectasis, cardiac failure, or fluid overload. Acute respiratory distress syndrome happens when inflammation causes diffuse alveolar injury or damage, diffuse alveolar necrosis, pulmonary edema, infiltrates, and hyaline membrane formation. Non-cardiogenic pulmonary edema resulting from acute alveolar to capillary damage. Sepsis and pneumonia are the most common causes. It is graded based on the severity of the changes in arterial blood oxygenation. Note: acute lung injury, ALI, also called non-cardiogenic pulmonary edema, is characterized by the abrupt onset of significant hypoxemia and bilateral pulmonary infiltrates in the absence of cardiac failure. This terminology is going out of use as ARDS is seen as a manifestation of severe ALI. The newer definitions include ARDS as a separate entity, and ALI is not being used. Both ARDS and ALI are associated with inflammation-associated increases in pulmonary vascular permeability, edema, and epithelial cell death. The causes: it's caused by direct injury to the lungs or systemic diseases, infection such as sepsis, diffuse pulmonary infections by viral, mycoplasma, pneumocystis pneumonia, or miliary tuberculosis, and gastric aspiration can all cause ARDS. Physical injury such as mechanical trauma including head injuries, pulmonary contusions, near drowning, fractures with fat embolism, burns, and ionizing radiation can also cause ARDS. Inhaled irritants such as oxygen toxicity, smoke, irritant gases and chemicals, as well as chemical injury by heroin or methadone overdose, acetyl salicylic acid, barbiturate overdose, or paraquat can cause ARDS. Hematologic conditions including TRALI, which is transfusion-associated lung injury, and disseminated intravascular coagulation, DIC, or disseminated intravascular coagulation can also cause ARDS. Pancreatitis, uremia, cardiopulmonary bypass, and hypersensitivity reactions to organic solvents or drugs can cause ARDS. Note: more than 50% of the cases of acute respiratory distress syndrome are associated with the four conditions of sepsis, diffuse pulmonary infections, gastric aspirations, and mechanical trauma including head injuries. The causes are diverse. The shared feature is that all lead to extensive bilateral injury to the alveoli. Idiopathic ARDS is known as Hammond-Rich syndrome. Acute interstitial pneumonia. This is widespread acute lung injury of unknown etiology associated with a rapidly progressive clinical course. It is sometimes referred to as ALI-DAD. It's an uncommon disorder that occurs at a mean age of 59 years and has no sex predilection. Patients present with acute respiratory failure, often following an illness of less than 3 weeks duration that resembles an upper respiratory tract infection. The radiographic and pathologic features are identical to those of the organizing stage of ALI. The mortality rate is high and varies from 33% to 74%, with most deaths occurring within 1 to 2 months. Recurrences and chronic interstitial lung disease may occur in the survivors. Causes accounting for more than 50% of the cases included trauma, shock, gastric aspiration, and diffuse pulmonary infection. Capillary damage leads to exudation of inflammatory cells, polymorphonuclear cells or PMNs, macrophages, RBCs, and protein into the interstitium. There is formation of an intraalveolar hyaline membrane. Neutrophils cause destruction of type 1 and type 2 pneumocytes, which triggers a loss of surfactant and then leads to atelectasis. This causes the formation of an intrapulmonary shunt, a VQ mismatch with no ventilation. Pathogenesis of ARDS. Capillary endothelial damage plays a major role in the pathogenesis of ARDS and is the most important step.